Firstly, you will introduce yourself.
My name is Dr. Reginald Satyaprakash Prasad. I have Indian heritage, but actually born in Fiji Islands.
How you reached to Stem Cell Care India and how was your experience during the treatment?
Right. Well, I started looking into stem cells as it was popularly advertised in our local papers in Darwin, where I reside for the last 20 years. And I followed it up eventually by going to the Stem Cell Research Centre in Melbourne and spoke to a lady called Megan Manzi, I think her name is, and she offered a note of caution to me, as apparently there are a lot of people who are involving themselves in stem cell who should not be. At any rate, I eventually got in touch with Stem Cell Care India by email, wishing to know more about the possibility of having my partial blindness in my left eye improved where I could see better by having stem cell therapy. And that's what got me to a person by the name of Nishat, uh,
Nishad.
who
Yeah.
is the marketing manager for this Stem Cell Care India. I was, in fact, as a medical practitioner, looking more from the point of view of statistics and quantifying people who were involved in it as to what their experience was and how successful they thought their stem cell treated patients were getting on. I eventually did speak to various people and came to know a bit more about stem cells. This is fairly, I recognize it's a fairly new sort of venture in medical care. And it kind of excited me that immature cells can be planted in various places where the need is, and that they would grow eventually into the normal mature cells and take over the function that they should be. And this concept really fired me to follow it through, and I've eventually uh, have got to India, to this specialized hospital, which is Ayur, what's it called?
Sarvodaya. Sarvodaya.
Sarvodaya
Yeah.
Specialty Hospital. Yes, and through that I've come to meet up with Dr. Madhav right there, who is the ophthalmologist, surgeon, specialist, who deals in the with the use of stem cells to settle macular degeneration, blindness. So yes, and I've been very excited talking to Dr. Madhav, who explained to me exactly what stem cells are and how they are involved in helping people to regenerate mature cells that take over the function of what rods and cones at the back of the eyeball in the retina, how they improve. And so, yes, I have. The hospital here, of course, is quite a big hospital, and nowhere near like what one would imagine in the English-speaking world. Certainly I've been to several, but mostly in Australia and New Zealand. And but it is run very efficiently, obviously. The nurses are all very alert, and very pleasant and well informed, and
And are you satisfied with the treatment part?
yes, well, I did have my marrow uh, extracted and used with blood to instill in the back of my eyeball, and yes, ever since the injection, when I came out of the anesthetic, I found that my left eye had improved noticeably. I could compare to what it was previously. Um, yes,
And
so
uh,
I'm very happy with Dr. Madhav right there with what he has done so far, and the rest of the staff are all very supportive, and I'm quite pleased with the result of it.
and would you like to say a few but about Stem Cell Care India and their teammates?
What I found was a little bit daunting initially was the fact that the hospital is run uh, largely by a marketing agency, and that to most Australians would be a little bit difficult to cope with, I would think. Uh, However, we overcame that eventually. A lot of emails uh, passed between us, and step by step we came to get reassurance about the whole operations. In fact, I was bold enough to even uh, consult the Indian uh, list of doctors, some of whom who are blacklisted. So I was very pleased to see that stem cell was not hospital was not mentioned in that list. So anyway, I've done my bit of homework, I suppose, in reassuring myself, and eventually the final step was I had to come here to Delhi, and in fact, from the very first day that I came, I've already had the marrow extracted, instilled in my eyes, and already seen some result from it. So overall, it is a very, I think, has a great hope for this new venture.
Okay, sir. Thank you very much.